A cough is a reflex action to clear your airways of mucus and irritants such as dust or smoke. It's there to protect you. This is comforting to know, especially when it's 3 in the morning and you're hacking your lungs out. There are two main types of cough: short and long-term coughs. Short-term coughs last less than 8 weeks, and they can be either acute, lasting less than 3 weeks, or subacute, lasting between 3 to 8 weeks. Anything lasting more than 8 weeks is a persistent cough or long-term cough, and the medical name for this is chronic. This classification is helpful, as if you've had a cough for 1 week versus 1 year, the causes are likely to be very different. The vast majority of coughs are acute and last less than 3 weeks. They're usually caused by an upper respiratory tract infection that affects the throat, windpipe, or sinuses, such as a cold or flu or laryngitis, sinusitis, or whooping cough. A lower respiratory tract infection that affects your lungs or lower airways, such as bronchitis or pneumonia, or an allergy like hay fever, where your airways are oversensitive to something in the environment, or a flare-up of a long-term condition like asthma or COPD. I'm making this video during the COVID-19 pandemic. Cough is one of the commonest symptoms of the COVID virus, along with fever and a loss of sense of taste and smell. In some instances, a short-term cough becomes a persistent cough. A persistent cough is when your cough lasts more than 8 weeks and it's caused by all of the causes of short-term cough lasting longer, like a long-term respiratory infection, chronic lung disease like asthma, COPD and bronchiectasis, allergy, and COVID. Additional causes of a long-term cough include things like smoking. You probably all heard of a smoker's cough. Post-nasal drip. This is when mucus drips down the throat from the back of the nose, usually caused by allergy or chronic low-grade infections. Gastroesophageal reflux disease. This is where the throat becomes irritated by stomach acid that travels up, especially at nighttime. Medicines. Some medicines can cause cough too. The commonest are ACE inhibitors, a medication that we regularly prescribe for blood pressure. Up to 1 in 5 people will notice a cough when they're taking this medication, and it doesn't just occur when you start it. It can happen after years of taking the medication too. Rarely, a persistent cough can be a symptom of a more serious condition, such as heart failure, clots in the lung, TB, or lung cancer. When patients have a cough, they're often worried that it's cancer, but this is really rare. All of the above causes are primarily relevant to adults. For kids, if they have a cough, it's usually due to a respiratory infection, same as adults, but they can also have things like asthma and reflux. There are a few common infections that mainly kids get that cause cough, such as things like bronchiolitis, which is a virus that causes cold-like symptoms in kids below 2 years of age, or croup, a virus in kids under the age of 5 that causes a barking cough and a harsh sound known as a stridor when a child breathes in. Whooping cough is another cause too. This is caused by an infection, but a bacterial one this time, so it does respond to antibiotic. This is usually associated with intense hacking bouts of coughing, vomiting, and a whoop sound with each intake of breath after coughing. If you have a short or long-term cough, we want to make sure that it's nothing serious. Most short-term coughs will get better by themselves within 3 weeks. If your cough hasn't improved by then, you should see your GP. You should also see your GP if it's really bad or it's quickly getting worse, or you feel really unwell with your cough, or you have chest pain and find it hard to breathe, or you're coughing up blood, or you have other worrying symptoms with your cough like weight loss, or a change in your voice, or lumps or swellings in your neck, or a weak immune system due to chemotherapy or diabetes. If you've had a cough, we'll often take a sample of any mucus you might be coughing up. We'll also consider an X-ray or allergy testing or a lung test to see how your lungs are doing. We sometimes consider a referral to a chest specialist if your cough is dragging on for ages with no obvious cause. Sometimes antibiotics may be prescribed for a cough that's been going on for a while and it seems infective in nature. They won't always be required though. The majority of coughs are short-term and due to a viral infection. It's not uncommon to be infected with more than one virus at the same time, so symptoms can overlap and last longer from start to finish. In this case, an antibiotic won't help and there isn't any specific treatment. That doesn't mean there aren't things you can't do to help though. In these cases, you can treat a cough yourself with the common things like rest, drinking plenty of fluids. Coughing often gets worse at night as mucus tends to irritate your soft palate and stimulates the cough reflex. Propping yourself up with pillows can really help dampen down the symptoms here. And other common prevention measures are also really important so you don't spread it. Do isolate, cover your nose and mouth when you cough and sneeze, and clean the common areas of your home too, and wash your hands frequently. Some people find things like paracetamol and ibuprofen are quite helpful to deal with any associated pain. Hot lemon and honey can ease symptoms too, but you shouldn't give this to babies under 1 year of age as it can cause infant botulism. Honey is a demulcent. It soothes and coats the throat and it minimizes irritation, while the lemon juice helps with congestion. Cough syrups, cough sweets, and cough medicines, you can get these over the counter at your pharmacist. They can also sometimes help. The main types of these are cough suppressants. These reduce the cough reflex and are usually used for a dry cough and include drugs like Folcodine or dextromethorphan. Expectorants for wet coughs to help break down and bring up mucus from the lungs. Examples of this include something like pelargonium. These don't get rid of the cough, but they make the cough more bearable. It's not clear if these over-the-counter remedies are any better than the simple home remedies like the honey drink or inhaling warm, moist air, but some people find them really useful. You generally shouldn't give these over-the-counter cough medications to kids under the age of 12. While we're on the topic of wet and dry coughs, normally a productive or wet cough produces a lot of phlegm and tries to get phlegm out of your lungs, and a dry cough usually occurs after a cold when the lungs are irritated or inflamed. Both are often caused by infection, with wet coughs commonly occurring at the beginning phase of an infection and dry coughs occurring towards the end and often for weeks after the first part of an infection. Back to management. If the cough is not due to a viral infection and has a different specific cause, you can be treated with more precise drugs, such as steroids and inhalers for asthma and COPD, or antihistamines and other tablets or sprays for allergies. If you're an allergic type person, it may be useful to avoid the allergens or triggers, especially at home, by keeping pets out of the bedroom and using things like air filters and purifiers. Antibiotics are helpful for bacterial infections like TB and whooping cough. Antacids are good for reflux. Coughs can be annoying and uncomfortable, but most of the time they clear up by themselves within a few weeks. Most coughs are short-lived and are caused by viral upper respiratory tract infections, causing problems like a cold or a sore throat. If a cough goes on for more than 8 weeks, it's a persistent chronic cough. Common causes of persistent coughs include ongoing infections, lung disease like asthma and COPD, reflux, and allergies. Cough is rarely a sign of serious disease. If you have a cough for more than 3 weeks, that's really bad and not getting better, and you have any worrying symptoms like chest pain or blood in the sputum, difficulty breathing, then you should definitely get it checked out. Most coughs can be managed with simple home remedies like warm honey and inhaled warm air. If your symptoms persist, you may have a cough cause that requires a more specific treatment for allergy, reflux, inflammation, or bacterial infection. Many thanks for listening. Till next time, stay healthy.